please do leave it on my page and I will be happy to answer the question for you. Hi, welcome to another episode of Talking with Dr. Donna. I'm your host, Dr. Donna, and the doctor is in. This show is about building generational health. That means that I want you to be your best self and the healthiest that you can be, so that you then can pass on that health to subsequent or the next generations. So that's what we're doing here with Talking with Dr. Donna. Today, I want to give you some updates on coronavirus, talk to you a little bit about coronavirus and flu, update you on the new shelter-in-place orders, and then also talk about a little bit of an exciting program that we have in partnership with the Alameda County Public Health Department. So let's start first with some updates about coronavirus. We in Alameda County are about to go into a shelter-in-place order. Why? Lots of people are wondering why. Because the trajectory of our cases of positive, people who are testing positive, is increasing. So if we look at what our overall rate is, right now it's 3.6%. That means in a 7-day period, people who test, we have 3.6% of those people test positive. What does that mean to you? That means that last week or 2 weeks ago, we were at a 2%. So we're increasing. So that means there are more and more people in our community who are testing positive for coronavirus. Why is that important for you? Again, because they can be asymptomatic. That means they cannot have any symptoms. That means you cannot look at them and see whether or not they have the disease, which is very, very dangerous then for those of us who are coming to contact with those people. That is why it is so important that you wear a mask whenever you go outside of your home. I have a mask sitting here because whenever I go out, I'm wearing a mask, and you should too. A mask or some sort of facial covering. And your facial covering should have some thickness to it. It shouldn't be so thin that when you put your hand in front of your mouth and you blow, that you feel the air. So you want something that has a little bit of thickness to it. That might mean that you may need to double it up, and then put it over your mouth and your nose. I know I go out and I see so many of you walking around and your mask is like this, over your mouth only, and your nose is completely open. You have to have it over your nose and your mouth, okay? That's number one. So we want to make sure that you are aware that the cases in our community are increasing. And because the cases of our community are increasing, that is causing our shelter-in-place modified order. The governor of California last week said for counties that have a capacity in their intensive care units of 15% or below, need to shut down. So that means if out of all of their ICU beds, they only have 15% of beds available, then that county has to shut down. And that's because as hospitalizations increase, as people get sicker, and the intensive care unit beds start to overflow with people who have coronavirus, what happens to those people who are having a heart attack or who are having a stroke or who have cancer and need the ICU for intensive treatment? That means there's no beds left for anything else. Now, that was statewide. However, in our region, I live in Northern California, so in the Northern California region, our Bay Area public health officers decided, even though we are not at 15% capacity, we're above 15%. Most of the counties and the ICU beds in our counties are somewhere between 20 and 26% capacity. So we're actually not as bad as the rest of the state. However, because of the upward trend in the number of cases and the number of people who are being hospitalized and the number of ICU beds that are being used, the Bay Area public health officer said, We're not going to wait until we get to that far at 15%. We're going to shut down now because we see where we're going. So that is so important that you understand that as more cases come into our community, we have to do things that are a little bit more drastic so that we don't continue the spread and continue the rise. So what does that mean for stay-at-home orders? Well, let's put that up on the screen so you can see what the stay-at-home orders look like. Stay-at-home orders all are going to go into effect either tonight or first thing tomorrow morning by 12:01 a.m. Every county in Northern California in the Bay Area goes back into stay-at-home orders. That means restaurants will only be open for takeout and delivery. No more dining outside, no more dining inside. Bars and wineries are going to be closed. No personal services, hair, nail salon, barbers, massages, all of that is closing back down. Retail can stay open only at 20% capacity. So anticipate if you're going to go out that you're going to have to stand in line. And as you're standing in line, remember to keep your distance 6 feet or more of space between you and the next person. And this is paramount right here. If you hear nothing else that I say today, hear this. No more gatherings. Let's say it together. No more gatherings. Only come with people who live in your house. No more small parties, no more small gatherings outdoors with other people in your home. None of that. Please stop. This is causing the spread. As I've said in other videos, coronavirus is social. It loves for you to be social because then it gets to hop from person to person to person. So stop socializing. Stay at home. Only go out when you absolutely, positively have to go get something. Essential services. So we're going back to where we were way back in March. If you remember those stay-at-home orders, that's where we're going. So stay-at-home orders go into effect tonight and tomorrow morning throughout the Bay Area County. Now you may say, why are they doing this? They're overreacting. We're not that bad. Listen, personally, I have lost a friend from coronavirus. I have lost a woman who was an inspiration to me from coronavirus. I have lost my aunt from coronavirus, and my husband just lost his uncle from coronavirus. This is real, people. People are dying. So I know it's inconvenient. I know you're tired, but people are dying. People are dying. In Alameda County, we have had 513 people die in our county. That's 513 people, mothers, fathers, brothers, uncles, cousins, sisters, who are no longer a part of someone's family. Now, if we can prevent 514th person or 515th person by staying at home, masking up, being socially distant when we go out, I think that would be worth it if that person that we saved was a relative of yours. If you look at our county, over 30,000 positive cases in our county. Again, this virus is not going anywhere anytime soon. And so we are going to have to do the things that we know right now are working. Wearing a mask or a facial covering, staying 6 feet or more away from people, and only socializing with the people who live in our households. No more socializing. We're looking at the flu. We're moving into flu season. Flu is going to compound the danger of coronavirus. Why? Because the symptoms are so similar. Flu and coronavirus look the same. Cough, runny nose, fever, body aches. So before you actually go out and get tested, you might think that you have the flu, but it turns out that you might have coronavirus. So it's so important right now as we're moving into tipping off flu season that you are super diligent. If you feel sick, stay home. Don't go to school. Don't go to work. Don't go out into the community because you're not sure if it's flu or coronavirus. If you are feeling, very sick, see your doctor early on. A lot of the cases that we're seeing with the coronavirus and their deaths is because people are waiting too long to actually seek medical care. So if you're feeling bad, you know your body and you're like, no, something's not right, go see your doctor quickly and make sure that your doctor hears what you're saying and addresses your concerns and addresses your issues. So we have partnered with Alameda County Public Health Department. I have a team of people who are working to do what's called contact tracing and case investigation. That's great because we need to know when someone tests positive that wherever they went and whoever they came into contact with also know that they have the potential to be spreading the disease. That's what we do with case investigation. So I have a great team of 7 people who are out here going to be making phone calls in the West Oakland area. We're going to call you if you are positive for coronavirus or if someone that you have been in contact with is positive for coronavirus. Look at these faces. Black and brown people calling black and brown people to give them information. We can help you with resources. If you have coronavirus and you're having to stay at home, that's impacting you financially, there are resources available to you. There is financial support for you. There is food support for you. There is housing support for you. So it's really, really, really a good response that our county is giving for those of us who are testing positive for coronavirus and for those of us who are coming in contact with people with coronavirus. So if you get a phone call from someone from my team and you live in the West Oakland area, I want you to make sure you understand that these people are working on your behalf. So please be nice. Don't be rude. Don't hang up on them. Take their phone call, hear what they have to say, and let them help you. We're in this for the long haul, people. This is not going to go away. We have a vaccine that's on the cusp of being delivered to Alameda County probably within the next week or 2. But the first phase of people who will get that vaccine are going to be healthcare workers and those who live in congregate facilities like senior nursing homes, places, residential homes like that. So for the average person, you and I, we're still several months away from actually receiving the vaccine. I'm going to do a show to talk specifically about the vaccine a little bit later, but I wanted you to know that the vaccine is here, it's coming, but for now, we've got to stay true to the things that we have the ability to control, which is who we come into contact with, and when we're in contact with them, how far apart we are with them, and more importantly, how we protect ourselves and how we protect them by wearing a facial covering, okay? Or a mask. All right, so I hope that I've answered some questions for you. I hope that I've given you enough information. I'm not trying to scare you, but I do want you to understand the gravity of the situation. I want you to understand that we are all in this together. What you do impacts me, and what I do impacts you. So let's build generational health by making sure that the generations in front of us and behind us are here and are healthy. All right, that is the message from Dr. Donna. Thank you for tuning in to Talking with Dr. Donna. I will see you soon. Remember, you always have an appointment with Dr. Donna. If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you.